Hi, I'm Dr. Kamfwa, a consultant in the Gynaec Oncology unit based at Cancer Diseases Hospital in Lusaka, Zambia. Cancer Diseases Hospital is the only hospital which treats cancer patients holistically. It's the referral center for the entire country. And the beauty about this hospital is that we have got different specialties. I completed my fellowship in India in 2018. This fellowship was in Gynaec Oncology. I was based at Tata Memorial Hospital in Mumbai. You know, Tata Memorial Hospital is a world-class center in as far as the treatment of patients is concerned. And of course, it was a privilege for me to be selected by Merck Foundation so that I could go for a fellowship there. Apparently, I was the first Zambian to go and do Gynaec Oncology. And I'm very grateful for what Merck Foundation did. When I came here to Zambia, one of the important things that we did was to set up this beautiful theater that you are seeing. And we then started operating the patients from here. These patients, they are the ones that we are going to be sent out for radical surgeries, such as radical hysterectomies or the debulking surgeries. But this time around, these patients are operated from here. So that was one of the successful stories of setting up this beautiful theater that you are seeing, and we start operating the patients from here in Zambia. The other thing was setting up of the clinic at Cancer Diseases Hospital. So what normally happens is that every Wednesday and Thursdays, we see these patients who require surgery from within Cancer Diseases Hospital, and these are referred from outside. And when they are referring, people have got the confidence that they are referring these patients to a specialist. And aside that, the other successive story was that when I came back, it was during this time that International Gynecologic Cancer Society had to identify Zambia as one of the sites where gynecologic oncology fellowship could start. So I was given this privilege to become the first local mentor for the fellowship. Even as at now, I'm the local mentor for Gynecologic Oncology Fellowship, which is offered here in Zambia under IGCS. And if you look at this, it's one of the successful stories, realizing that we have already produced one of the fellows. Then apart from that, because now we have started building up this team which can be doing complex surgeries, and most of our patients, they are based in the rural areas. So what we started doing was to upskilling the skills of the gynecologists in the rural areas. So we do invite them to come here so that they see how we operate the patients, and afterwards we also go to do supportive visits and mentorship to operate on the patients out there. And this is so successful. Reason being is that previously, you know, this thing wasn't happening, but it's one of the successful stories that we can say it has been happening. Again, when you look at what has happened, these patients who are being operated from within Zambia, Previously, because we didn't have specialists like gynecologic oncologists, they were going to be referred to go to these other countries in order to receive those specialized treatment pertaining to surgery. But this time around, there is a reduction in those referrals. All the cases, they are just done from within Zambia, and that's the beauty which is here. So what does it mean? It means that one, the patients, they have got access to the local specialists. At the same time, instead of spending a lot of money outside, they do not spend. And at the same time, when it comes to the subsequent reviews, they are reviewed from within the country. And that's the beauty which is associated with that. All these had to come because of Merck Foundation. We can say Merck Foundation has been in the country and it has done a lot for us, not just for me, but for the entire country. If you look at what I've said, it has done a lot for me as an individual and even for the country, looking at the patient welfare. And we are so grateful to Merck Foundation. I was not the only one who was selected for Gynecologic Oncology Fellowship. The success story had to continue because another colleague of mine had to go again for fellowship in gynecologic oncology, and he has completed and he has come back to the country. So he is somebody that we work with in this theater. So meaning that we have got two consultants who were trained under the Merck Foundation, and they are based here at Cancer Diseases Hospital, doing so much work for our country in trying to reduce mortality and morbidity, which is associated with cancers. For sure, what I can say to Merck Foundation is that we are so grateful, Merck Foundation, for the change that you have made into our lives, the change that you have made into my life, and for sure the change that you have made for our country and for the community at large. Thank you, Merck Foundation, and please continue doing the wonderful work that you have been doing as a weather friend. Thank you so much.